The global economy is projected to create around 40 million new health sector jobs by 2030, mostly in middle and high-income countries. Despite this growth, there is a projected shortage of 18 million health workers in low and lower middle-income countries. The Commission, co-chaired by President Zuma, has made 10 recommendations that seek to address this. The report was handed to the Director General of the World Health Organization, who accepted it on behalf of the Secretary General.
The world needs to focus on the potential of the health sector to generate millions of jobs if we are to increase health security at the national, regional, and global levels. This need is particularly urgent in developing countries.
The goal of the report to point the way to a world where all countries have the health workers and infrastructure they need. Lessons learned from the deadly outbreak of Ebola in West Africa last year.
The Commission is making 10 recommendations to the member states of the United Nations, ranging from training needs, continuing education, and the need to focus on primary health care. The report also deals with health emergencies, ensuring the safety of health workers, addressing underserved areas, and the benefits of using information and communication technologies.
The report calls for its recommendations to be prioritized over the next 5 years.
By following this roadmap, we can progress towards universal health coverage, create millions of jobs, and drive inclusive economic growth, especially for women and young people. The health sector is an economic powerhouse.
The report will now be submitted to member states with a warning that those countries who do not make the adequate investments in the health sector will not only be jeopardizing the health of their citizens, but risk missing out on a vibrant source of jobs and inclusive economic growth. Bryce-Pease, SABC News, New York.